Hello, Mr. Rodriguez. It's so nice to see you again.
Likewise.
I'm glad you came in for a follow-up appointment. I'm going to be performing the rest of the head to toe today. And if at any time during this assessment you feel uncomfortable, you just let me know. First, I want to make sure that everything's going okay with your health insurance and that you have equitable access to health care.
Yes.
Okay, that's good to know. So first thing I'm going to look at, like last time, is your mood and your appearance and your overall look. So you look well groomed, your affect is appropriate, and your skin is well complected for your ethnicity. So, and you're feeling okay, no depressed mood?
No.
No anxiety, no restlessness?
Nope.
Okay, and you're having any trouble sleeping, or you're okay sleeping?
I'm a little tired now, but I'm fine.
Okay, and everything's going okay with work?
Yeah.
Okay, good. Now I'm going to be asking you about some questions to assess your mental status. It is a question we ask everybody, so don't be alarmed by the questions. So I want you to tell me your name, your age, and your date of birth, please.
Yes, Miguel Rodriguez, October 15th, 1978, and 46 years old.
Okay, great. Let me check and make sure that's the right information. Yes, okay. And can you tell me why you're here?
Just doing a follow-up, head to toe checkup with you, as recommended.
Oh, great. Okay, I'm just going to ask you to do a couple things. So can you touch your nose for me, please? And can you stick out your tongue? Okay, perfect. I was just assessing that you were oriented to person, place, and time, and that you're able to follow simple commands.
Okay.
And you aced that.
Awesome.
First part of the neurological exam is going to be the olfactory nerve. I think you're familiar with this one. I'm going to place something under your nose. I want you to tell me what it is by smelling it.
Cheese it.
Yes. I'm now going to test your optic nerve. I want you to follow my fingers. Okay. I'm going to test your oculomotor nerve now. We're going to assess the 6 cardinal fields. Just follow this with your eyes. Good. I'm going to check your pupils now. Now look right into the light. Okay. This side. Okay. Your pupils are equal, round, reactive to light, and accommodation. I'm going to test your trigeminal muscle now. I'm just going to touch certain places on your face, and I want you to let me know if you can feel that.
Yes. Yes. Yes.
Okay. And on this side?
Yes. Yes. Yes.
Good. And I'm just going to palpate parts of your face. We're looking for symmetry, no lumps or bumps. Can you do me a favor and can you clench your jaw? Okay, I want you to go like that, smile, and then frown. Okay, good. Last time I did the whisper test. Now I'm going to do a different test to check your vestibular cochlear nerve to make sure your hearing is okay. So I'm just going to make a little noise in the back of your head.
Yes.
You can hear both of that. We're now going to test your glossopharyngeal nerve. That's the one that innervates the tongue. Okay, I want you to open up. I want you to say, ah. Okay, I'm just going to lightly touch back here. Okay, intact gag reflex. I want you to stick your tongue out straight and move it around. I'm just looking for symmetry and no droopiness. Everything looks good. Have you noticed any hoarseness in your voice?
No.
Okay, good. And have you noticed any difficulty swallowing at all?
No.
Great. I'm going to check your spinal accessory nerve. I think you may remember this from last time, so I'm going to put my hands on your shoulders, and I want you to shrug against resistance. Okay, good. I want you to turn your face to the left against resistance, now to the right. Okay, perfect. Nice and strong. I'm just going to look at your upper arms for muscle symmetry. Okay. Let's look at them together. All right, palpating. Everything feels normal. This is the part of your brain that controls the coordination of movements, walking, and things like that. So if you could stand up for me, please, and we're just going to do a couple little exercises. So the first one is walking in tandem. And that is if you put one foot directly in front of the other to walk, like this. Okay? Good. All right, that's good. And can you stand on your tiptoes? All right, good. And can you stand on your heels? Okay. Can you stick your arms out? All right. And I'd like you to take one finger and bring it over and touch your nose. And then do it with the other finger. Okay, perfect. Like that. And put your palms up and close your eyes and count to 10 again.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Perfect. That's the pronator drift test. Thank you. So we already did the finger to nose. We're going to take our palms. We're going to pronate back and forth like that. I'm just looking for symmetry. Okay, perfect. Good. Flexibility's there. Normal muscle. We're going to do the heel to shin test. So here, just put your feet. Yeah, perfect. You know what to do. It's pretty explanatory. Okay, great. From these tests, it looks like you have a balanced gait, no swaying, and coordinated movements. The first thing is I'm going to touch you with an object, and I want you to tell me whether it is sharp or soft. You can't look at it.
Sharp. Soft. Sharp. Sharp.
Did you not feel that?
Do it again.
That's okay.
Soft. Soft.
Okay. I'm gonna now check your proprioception, which is a person's ability to feel themselves in respect to their surroundings, and it's part of the balance and coordination tests. So I want you to close your eyes, and I want you to take your fingers and move them, close your eyes, and move your fingers up and down. And then I want you to stick one foot out. You can finish that, and put your toes up. Just the toes. And then the other toe. The other foot. Okay. You're good. We're going to do the vibratory part of the proprioception, which is just having a vibration and feeling that. Okay. Now I'm going to test your stereognosis. Can't look. I'm going to put a familiar object in your hand, and I want you to identify what it is. So open your hand. Okay, close your hand and feel it, and let me know what that is.
Nearby.
Perfect. Thank you. You have passed that test. Now we're going to test your graphesthesia. This is a test where I'm going to take your palm and I am going to write a symbol in it, and I want you to be able to tell me what that symbol is.
Number 8.
Perfect. I'm going to test the 2-point discrimination. I am going to touch you with 2 objects, and I want to make sure that you feel both of those objects. So let me know if you feel both or just one.
Oh. Oh. Oh.
Okay. Now we're going to test extinction, which is doing a very similar thing, except you're going to tell me where on your body that you feel the 2 points.
Triceps.
Perfect.
Wrist. Knees.
Good. We're going to do the abdominal assessment. The key rule of thumb in nursing is that we always look, listen, and then touch. So first, I'm going to look. I'm going to look for your abdominal symmetry. I'm going to make sure that there is no abnormal pulsations or any abnormal patches of hair or anything untoward visually, and everything looks fine. So now I'm going to listen, and I'm going to start with your bowel sounds. There's 4 quadrants, and each quadrant I'm going to listen from 5 to 15 seconds and make sure we hear the bowel sounds, which, as you know, is, as you probably know, is little gurgling noises that sometimes you can audibly hear without even having a stethoscope. All right. Now I'm going to listen to the vascular sounds, which the first one is the aortic. I'm going to use the bell of the stethoscope. Okay, thank you. Then the iliac. And the femoral. Okay. Now I'm going to percuss, and I'm going to take my finger and gently just tap around. Normally in the abdominal area, it's tympanic sounds, which means it's more like open area sounds. Over certain organs, you will hear a dullness, like in the liver and sometimes in the spleen if it's percussible. So that's good. So tympanic sounds all over, which is normal. I'm just going to palpate. So I'm going to do a mixture of light and deep palpation. So if it's okay, you could lift up your shirt one last time. And then I'm just going to feel around. No, you don't have to take it off. Just lift it up. Yeah, that's perfect. Thank you. So, and you're going to let me know as well if you feel any pain with this. So, palpating here, I'm going to ask you to take a deep breath. And under this costovertebral angle, you feel a little bit of, you feel something, and that is the liver. And it's typically felt between 6 and 12 centimeters, and it's right behind the rib cage. And that's the best way to listen to feel it is when you take a deep breath, because it kind of opens that area up. Then I'm going to feel over here, and then in the back where the kidneys are, they're not usually palpable. Okay. And then your aorta, this is the vessel that all the blood comes through to feed your body below your head. Feels good. We're going to check another part of the neurological exam, which is your deep tendon reflexes. So I'm going to tap on certain parts of your body and see how your body reacts and make sure there's that reflex there. You're probably familiar when a doctor does this and your leg goes up. That is exactly what this is, except it's checking other parts of your body for the same reaction. So first, you just relax your arm gently, and I'm going to tap ever so firmly right here. Okay. And then the back. Don't do. All right, let's do that one more time. Okay. Okay. And then we're going to do your brachioradialis. Okay, perfect. +2 all over. Now I want you to relax your legs so we can do the patellar region. I didn't hurt you, did I? Oh, okay. And then the Achilles. Oh. And then I'm going to do your foot, which is the Babinski reflex. And I'm going to tap on the sole of your foot. And I want to make sure that the foot curls in and doesn't fan out, which is, if it fans out, that's an abnormal reaction. And that's something that people are supposed to grow out of after infancy. Okay, I'm going to see your foot. There we go. All right, good. Now we're going to check your extremities for strength, flexibility, symmetry with movements. So here's your clavicles. I'm just going to palpate. I want you to lift your shoulders up against resistance. All right. I want you to put both arms out. We're going to extend. Okay. And we're going to turn our hands. I want you to clench. Turn your hands like this and clench. All right. And I want you to flex and then extend. I want you to bring your hands forward. Okay. Open your palms. Flex again. Okay, you can put that down. And then I want you to open your arms up to the side like that. Perfect. Okay. Now I'm going to check your legs. I'm going to check your pulses before I check your legs. We're checking this because we want to make sure that you're having all the proper blood flow to your extremities. Good. So I'm just going to inspect your legs. We're going to act like I can see. I'm not going to ask you to take all your clothes off, but we're going to act like you have your pants off and I can see all of your skin. So I'm looking at your thighs. I'm checking your knees. I'm going to ask you to, actually we'll do it at the same time. Let me see both your legs. Let's extend straight out if you can. Perfect. I want you to point your toes towards yourself and then point them towards me. Okay. I want you to bend your knees now. We're going to flex. Okay. Going to check the pulses on your legs behind your knees. Good. It's always very important to make sure that there's blood flow to the extremities. As we get older, sometimes that slows down and it can be indicative of diabetes and poor perfusion, and it's always something to keep an eye on. So now we're going to check the pulses down on your dorsalis pedis. Okay, always good, because the feet are the furthest thing from your body, and if there's ever an indication that there's not enough blood flow there, that could indicate a problem, like I was saying. And sometimes people don't realize it. For example, if somebody has diabetes, they could have a rock in their shoe and be walking around with that rock in their shoe, and they won't feel it, and then they get home and they look at their foot and they have a wound, and then that wound ends up being something that never heals. So we always have to be extra careful. Final test now is going to be checking your spine. So if you would please stand up for me. So I'm going to go behind you. First thing I'm going to do, you look straight ahead. I am going to look at your spine and see if there's any unnatural curvatures. Everything looks symmetrical and properly placed. And then I'm going to look from a lateral position, and it also looks in good shape. So now what I would ask you to do is if you could just bend at your waist, bend down. I want to see, okay. All right, everything's smooth. All right, you stand up for me. Okay, and I want you to twist to the right. All right, now twist back all the way to the left. I want you to bend your body to the right like that. Okay, and then let's do it again on the left side. Okay. Okay, Mr. Rodriguez, it was so nice seeing you again. I appreciate you coming in and taking care of your health. This is how you stay on top of things. And if there's ever anything that you need, you just call us up. If you ever have an issue with your health insurance or any difficulty obtaining health care, you call us immediately and we will help you. All right. So good seeing you again.
Thank you.
Okay.